Carcinogen, alkylating agents. Source: alkylating agents are a type of chemotherapy used to kill cancer cells. Effect: while treating cancer, they can also damage DNA in normal cells. Organ affected: blood and bone marrow. Cancer caused: increased risk of leukemia and lymphoma. Mechanism: cause mutations in hematopoietic stem cells. USMLE Question 1. A 60-year-old woman with a history of breast cancer treated with chemotherapy 5 years ago presents with fatigue, bruising, and frequent infections. Lab testing reveals pancytopenia, and bone marrow biopsy shows abnormal myeloid cells. Which of the following is the most likely cause of her current condition? A. Radiation exposure. B. Epstein-Barr virus. C. Alkylating chemotherapy. D. Aflatoxin ingestion. E. Smoking. C. Alkylating chemotherapy. Prior alkylating agent use is a known risk factor for developing secondary leukemias years after treatment. Why not the others? A. Incorrect. Radiation is a risk factor but less specific here than chemo. B. Incorrect. EBV is associated with Burkitt lymphoma and nasopharyngeal cancer, not AML. D. Incorrect. Aflatoxin affects the liver, not the blood. E. Incorrect. Smoking is linked to lung, bladder, and pancreatic cancers, not leukemia directly. USMLE Question 2. Which of the following best explains how alkylating agents increase the risk of developing leukemia? A. Inducing p53 overexpression. B. Activating proto-oncogenes. C. Creating DNA crosslinks and mutations in bone marrow cells. D. Enhancing apoptosis in B cells. E. Inhibiting growth factors in stem cells. Correct answer C. Creating DNA crosslinks and mutations in bone marrow cells. Alkylating agents damage DNA by adding alkyl groups, causing mutations in hematopoietic cells can lead to leukemia or lymphoma. Why not the others? A. Incorrect. p53 overexpression usually prevents cancer. B. Incorrect. These are not proto-oncogene activators. They cause DNA damage. D. Incorrect. They damage both cancer and normal cells, not selective B-cell apoptosis. E. Incorrect. Growth factor inhibition is not the main carcinogenic mechanism. Let me know if you'd like